Hello, I'm Helen Fu, the host of this TV show, Health Factor with Helen Fu. I'm also a certified nutritionist, Chinese herbalist, and a specialist in diet, nutrition, weight loss, diabetes, and cancer. Traditional Chinese medicine, which is also called TCM, has 5,000-year history. There are different methods of treatment. Acupuncture probably is the most well-known in this country. Today, I'm very excited to have a guest, Joy, to be the guest on my show. Joy, welcome.
Hi.
Okay, so Joy, tell us a little bit more about your background and what do you do?
Okay, I went to school in China. I got 5 years of intensive training in Western medicine and the traditional medicine. Then I was working in the hospital, also taught at school, at college for about 10 years before I came to the United States. In the early 90s, I came here. So I got certified in Chinese herbal medicine and acupuncture. I was also licensed in acupuncture at Massachusetts and New Hampshire.
Great, that's a pretty extensive background. So tell us a little bit more about the trainings. What does it require to become a licensed acupuncturist?
In here in the United States or
in both the United States and China?
So in China, we went to medical school or a traditional Chinese medicine school. It usually is 5 years training. We study both Chinese medicine and Western medicine. We go through everything medical school students go through, plus we get trained in traditional Chinese medicine. In here in the United States, there are many acupuncture schools as well. Most schools require students have a bachelor degree before you go to acupuncture school. The school, different school runs differently. Most of the schools have 3 to 4 years training for a master degree. Then you pass a national exam, then you apply for your license at a state where you wanted to practice.
Is it very hard to get your license?
You have to study hard.
So I guess it's the same thing anywhere, whether in China or in the United States.
Yes, that's
you
right.
You have to study and put in a lot of hours.
Yes.
And so I'm just curious, when you study acupuncture, do you study mostly through the books or you have to study through actual doing acupuncture on people?
Of course, you study from books, but a lot of it you have to practice, especially acupuncture. It needs a lot of hands-on practice. So in school, as a student, you practice on yourself first. So you needle yourself. You practice on paper, some other materials, practice needling, and then you practice on yourself, you practice on your fellow students, then you start to practice in student clinic on patients.
I guess it gives you incentives to really learn it and master it if you have to practice on yourself.
Yes.
Right? So you don't want to keep on doing the wrong thing on yourself.
That's right, yeah.
Yeah, so how many acupressure points are there in the body? I understand there are a lot of them.
There are a lot of them. So there are 14 main points, main channels, which we also call it meridians. Each meridian has certain number of points. So at least there are 500 points, but there are new points being developed all the time. We call those ash points or new points. And in the recent decades, we also developed the ear points. We call that auricular acupuncture, the ear acupuncture. So there are many points on the ear too. So it could be like thousands of points.
Yeah, well, I'm just fascinated by the ear puncture, and I tried it in China, actually. I studied acupuncture in China as well, but it's not part of my practice. I can put needles in myself and my kids, and but I'd rather prefer to refer my clients to acupuncturists like you. So I just wonder whether you'll be able to do some demonstrations today I'm
Sure.
volunteering to show the audience how acupunctures work. And first of all, tell us, does it hurt to put needles in the body?
I'll say no, but also depends on the area. If we needle sensitive area, like towards your fingers, your toes, those area has more nerve endings, so you may feel a little bit sensation. The sensation from from the acupuncture is not pain. It's the qi sensation. It's the energy. So many people will feel some sensation. It's not necessarily pain. They can feel heaviness. They can feel warmth. They can feel, tingling, numbness around the needles. Sometimes the sensation will travel around the channels. So these are not pain. If you do feel some sensation, it will be quick. When the needle goes through skin, you may feel a little pinch, then it goes away.
All right, because I understand some of the audience probably may never ever had a chance or the courage to try the needles. And tell us a little bit more about how acupuncture actually works and what's the whole theory behind acupuncture treatment.
Yeah, acupuncture is an ancient therapy. It was originated from traditional Chinese philosophy, where the disease is considered occur when as a consequence of the qi, yin and the yang imbalance. If the imbalance occur, the disease will occur. So we use acupuncture to insert the needles into specific points on specific channels to restore the balance, restore the yin and the yang harmony to your body. The channels, also called the meridians, are the pathway between the surface of the body to the internal organs. It also carries the energy into different parts of your body. So if there's a blockage in the channel, it will break the balance, harmony of the body. So using acupuncture to open up the channels to remove the stagnation will restore the harmony into your body.
Okay, so I just want the audience to imagine this. If you have a water hose and you have some pebbles or whatever, sand in the water hose that kind of started some blockage, then that's going to kind of reduce the flow of the water. And it's the same thing for our energy in our body. So when there is blockage caused by inflammation or could be toxins, whatever that is.
Yeah, or blood stasis. Yeah.
So basically, acupuncture is supposed to go there and get rid of the blockage so the energy can flow freely. Okay, so I understand you have a chart. You want to show us the chart and tell us a little bit about what the chart is all about?
This is a chart shows some of the meridians on back of the body. So there are different lines, the yellow line, the red line. So each organ has a pair of meridian. They are symmetrical on both sides of the body. This is the chart shows the bladder channel. It goes down from your head all the way to your toe. So each organ has a pair of channels connects the surface to the internal organs. That's just part of the meridian charts. We have total 14 main meridians. The meridians are like rivers. There are main rivers and there are small branches. The branches are connecting to other meridian, like other rivers. They all interconnect like a big circle, so the energy can flow all over your body. Anywhere has a blockage, it can cause the problem.
All right, so I'm excited and I would like to try
Sure.
the ear needles, and I will let the audience know how it feels like.
That's good. So I'm going to do a couple needles on your ear.
Okay,
And I'll probably
left
put
ear?
one
All
on
right.
the top of your head.
Okay, and explain
So-
to us why do you put the one on top of my head and why do you put the needles in my ears and what do they do?
The ear points are for relaxation. One of the points is called Shenmen. That means the gate of the spirit. It helps to reduce the stress and the anxiety.
Oh,
it
good.
also
A lot of
helps.
people need that.
It helps with the sleep too. And the point on the top of your head, it's a good point to help with the concentration and to help the mental clarity.
All
so
right.
It will help you to improve your memory.
I need that.
So the needles are coming in single package. They are pre-sterilized. They are single use, disposable. So we use alcohol to clean the skin first. And here you go, the needle. It comes with a little tube too. So what I'll do is I'll point the needle on her ear, then just tap, and the needle goes in. Did that hurt?
No, it doesn't hurt at all.
Okay. So here comes the second point, and it's in.
There.
So
I didn't even feel anything.
So ear has very little tissue. It's just skin and the cartilage. So the needle doesn't go in very deep. You just tap in.
Okay.
But different parts of the body, we do different depths. So
All right.
the same thing on the scalp. You can't go in deep. So what I'll do is,
You want to show the needle to the audience, what it looks like?
sure. So this is a common size of the needle. It's about 1 inch long. It's very flexible. So we just take one needle. So what I'll do with this point is I do oblique insertion. So it goes in like this with an angle. We cannot go deep this way, but we can go far towards the back of her head.
I start to feel a little bit now.
What do you feel?
Feel a little bit numbness and tingling.
Okay, so after the insertion, we usually do a little bit of stimulation, like twist the needles a little bit
Yeah, I can feel a little
to
bit.
gather the qi, gather the sensation.
Uh-huh.
So that's when you will feel the qi sensation.
Yes.
Okay. How do you feel?
I feel good. I feel
feel good?
relaxed.
Okay.
Yes. Well, sounds great. And you also, we have another volunteer
Okay,
who is
so
very excited to get on the show. And
I love
yeah,
to give
yeah,
her
and
some
so-
treatment too.
you can do some treatment on her.
Sure.
And her name is Anya. Anya, come on the show.
Hi, Anya.
Hi.
Hi.
Thank you for inviting me.
Yes. While Anya is trying to get ready, put the mic on. So you want to show us the different needles here?
Sure. So the needle I showed you are the common size. It was a 1 inch needle. The one I used for Helen's ear, they are very small. It was like 1/2 inch long. I have longer one. This is 1.5 inches. This is 2 inch needles.
That is called the horse needles, right?
No, horse needles could be longer.
Okay, those
so-
long needles, like, do you have special points that where you put the long ones, which ones where you put the short ones?
Yeah, it depends on the location of the points.
Okay.
So the long needles are for deep muscle area, like your leg, somebody's lower back.
Okay.
It also depends on the person. If you use acupuncture on a child, you use a very small needle. If you use acupuncture, you need a big person, so you need to have the needle reach certain depths in order to have this to work.
So for somebody who is probably like a little overweight, then they might need longer needles
Yeah.
than somebody who has regular weight.
Yeah.
Okay, I understand
So
that. Okay.
the same thing like in your ear, you can't go in deep, so you use very small needles.
Okay.
So
That makes
for
sense.
for her, I'm going to needle her hand.
Are you
so
ready,
we
Anya?
can
Yes, I am.
we can insert the needles a little bit deeper on her. So same thing, it's a 1 inch needle. We tap needle in, then I'll push the needle a little bit deeper. So you got some sensation, right? I saw your
Yeah.
finger moving. So that's about half an inch in.
But the interesting thing is that I really didn't feel the needle going in,
Yeah.
but I do feel some type of sensation going on there, and it's a very
So-
nice feeling.
Does it hurt?
No,
Are you scared, Anya?
no, I had acupuncture done before, 7 or 8 years ago, and it has been a very good experience. So I definitely am gonna go for acupuncture again. It's just sometimes hard to find time when you have 2 kids. But it was a very good experience for me, and I really enjoyed it. I really felt that it helped me.
That's
So,
great.
Joy, now you put one needle in each hand and explain to us what acupressure point and what does it do there.
This is called He Gu. It's large intestine 4. So this is on large intestine channel, the number 4 point on large intestine channel. The channel goes up to your arm, all the way go along your neck, go to your face.
Okay.
So this point can treat local problem, like your hand, your elbow, any pain on your arm, and as well as some facial problem. Plus, this point is on large intestine channel, so it treats large intestine problem, like digestive problem. Okay, if you have any digestive issue, this can treat. This is most used point in acupuncture.
Okay.
It's widely used.
So it's also very good for immune system.
It also
assume,
very
right?
good for moving qi,
Yeah.
release stress. It's good for immune system too, for different type of pain, not just local pain. Like I said before, the channels are all interconnected. So needle, large intestine channel, it can also help with other channels because they all related. So this is very common used. It can use for common cold too.
Okay.
Yeah.
So let's say winter is coming and you feel a little bit tired and you want to have acupuncture done. How many sessions would you have to get, and how many needles you would have to have put in each session?
Well, if you are a very healthy person and just for coming for a little boost of the immune system, you can do this like every other month or once every quarter, like when the season change, you can get a treatment boost your immune system. As of how many needles, it depends. It depends on your individual situation. Can be about 10 needles, 20 needles. It's common, for most people, they receive about 20 needles, plus minus.
Well, great. Thank you so much. You are brave, Anya, to
Thank
get
you.
on our show and have the needles put into you. So I
So-
understand that,
Let me take
you're
her
going to
needles
take off
out.
the needles. Okay, let's do that. You also have a lot of different other treatments in your center other than acupuncture, right?
Yes, I also do Chinese herbal medicine, so treat different conditions, use herbs. The traditional Chinese medicine, like you said, it's not just acupuncture, it's the herbs and the other treatment modalities. So in acupuncture, we do insert needles to almost every patient. We also do. Thank you, Anya.
Thank you.
Thank you so much, Anya.
Thank you
You're
very
welcome.
much. We also do cupping and gua sha, maksa. This is a cup. We use suction cup, do cupping on different points to release the stagnation too. We also have this so-called maksa. It's a maksa roll. We let up the maksa. This is made from herb. So we warming up the points to treat certain problems. So it depends on individuals' needs. So we do different type of treatment. So in modern acupuncture, we also do electrical stimulation, where you connect an electrical machine with the needles to give more sensation. It's a stronger type of treatment. So people will feel the qi all the time because the machine sends out the vibration.
Great. You also brought some photos and slides. I wonder whether you can tell us a little bit about the photos and the slides, if we can have them on the
Sure.
screen so Joy can tell us about the photos.
Okay, this is one of my treatment rooms. The lamp standing on the floor is a heating lamp. During the treatment, I'll use the lamp to treat different problem too. It's a
bring some
therapeutic
heat,
lamp. Yeah, bring some heat to injured area or painful area.
Okay.
If you don't have pain, I will use the lamp for your feet. Try to help you to relax during the treatment. You should feel very relaxed after each
great.
treatment. That's another angle of treatment table. This is the herbs. They come in the powder form in the individual bottle. I'll make the formula which will be designed specifically for each patient who's taking them. It's a formula with 10 to 15 herbs. I'll mix them together, then you go home, drink as you drink tea.
Okay, great. So this slide talks about TCM, traditional Chinese medicine.
Yeah, traditional Chinese medicine, acupuncture is part of it. We do
Yes.
Chinese herbal medicine. We do Chinese type of tuina massage. It's called tuina
Yes.
or acupressure. We do dietary therapy, which you are very familiar with that. Yeah. We also do mind and body exercise like qigong, tai chi. These are all part of traditional Chinese medicine.
That's true.
Yeah.
And there are some different types of needles.
Yeah, there are different type of needles. There is some different shape of needles. The one on the bottom left is called 7-star needles. It looks like a little hammer. On the hammer head, where it has 7 needles. We also call this plum blossom needles. It's like a plum. So you tap on different points.
This is the ear acupuncture points. I have 2 needles now in my ear. So tell us a little bit about this ear acupuncture points.
Imagine the ear like a upside down baby in the womb. The earlobe area is the head. The baby is crawling, like a fetal position. So the outer side of the ear is more the skeleton area, your spinal area. So the internal organs are right around the ear, opening of the ear canal.
Okay.
So if you have problem with your eye, we choose the point on the earlobe where it represents eye.
Okay.
Then you needle that point. It will help the eye problem. So if you have liver problem, then we choose the liver point, which is near the ear canal, to treat the ear problem. Yeah.
Okay. That's amazing. And so what acupuncture really can treat? I understand it can treat a lot of different symptoms and health issues. Could you explain a little bit more about it?
Sure. First of all, we can use acupuncture to improve general health. You don't have to have problem to come to acupuncture. People using acupuncture as a preventive method, for prevention. Like just Anya said, if I just want to preventing winter cold, what do I do? People coming just once a while for boost treatment to their immune system. Okay. But then when you have a problem, you can get treated by acupuncture. There are many problems acupuncture can help. So starting, say, neurological problem, if somebody have neuropathy, different type of nerve pain, sciatica, headache, like a facial Bell's palsy, facial paralysis. These all can be helped with acupuncture. We can help people with a digestive problem, like nausea, vomiting. It can be from morning sickness. It can be from different reasons, indigestion. People coming for IBS, constipation, acid reflux.
You see a lot of those probably.
Yeah, I see a lot of those. And the musculoskeletal problem too. When you have an injury, you have swelling, you have pain, acupuncture can help with the healing of injuries. Yeah, even you have a broken bone, we can help with the healing process. So other type, I see a lot of people with low back pain, neck pain, different type of injury in the arm, in the wrist, legs too, tendonitis, bursitis, and all kinds of different problems. And as well as gynecological problem with irregular period, painful period, people having infertility, or like menopause syndromes too. So they are being used very widely. Yeah, I can't go over everything.
Go over everything.
Yeah,
That's true. Yeah. And how about cancer? Because I work with a lot of cancer patients, and a lot of times I use Chinese herbs with them. I also recommend them to use Chinese acupuncture. I refer them to acupuncture treatment.
Many cancer patients with pain, whether you're beginning stage or late stage, acupuncture is a great tool to relieve the pain. Also, when people going through chemotherapy, radiation, when they have many different type of side effects from those, like I said, nausea, vomiting, lower blood counts, fatigue, neuropathy, those are also very helpful to use acupuncture. In fact, I'm working at the Dana-Farber Cancer Institute for many years now. We helped many cancer patients. I see many cancer patients at my private practice too.
Okay, great. So even though they are doing the traditional methods with chemo, radiation, or surgeries, they can still use acupuncture to help them. With the
If they come, if they come to us early enough, we will suggest them to start a treatment before you go through the chemotherapy or radiation, to just get your body stronger to deal with the treatments later on. So we also can help many people going through emotional stressful situation to help reduce the anxiety, depression, insomnia too.
We see a lot of those. In my practice, a lot of clients have those health issues as well. So if people want to get help from you, or they want to do a consultation or do treatments with you, how do they get in touch with you?
They can find me on the website. I have a full-page website. I have email. You can email me. You can call me. I'm there every week.
Okay, great. So they can go to your website, and it's called the China Acupuncture Health Center. Thank you so much, and we are so excited that Joy come as a guest to tell us all about acupuncture today. So stay healthy until next time.